Hello, this is Barbara Kennedy, and this video is my introductory presentation about the fantastic health building program called Functional Diagnostic Nutrition. Thanks to the founder, Reed Davis, who for many years analyzed saliva, urine, and stool tests, connected the dots of clients' reported symptoms with their test results. This program now operates in many countries, and I believe at this time there are more than 500 very active FDN practitioners helping people solve the real reasons for their health problems, allowing them to better and better their health. So here we go. This is a two-part introduction. The first part lays the base of understanding for the adrenal stress hormone test, which is a saliva test, and the metabolic assessment test, which is a urine test. As most of us are well aware, people are facing unprecedented levels of health problems that are stress-related, and they include allergies, acne, rosacea, blood sugar problems, diabetes, insomnia, sleep problems, wakefulness, headaches, fogginess, indigestion and bloating, fatigue, lethargy, or a sense of not feeling well or malaise, inflammation, pain, asthma, restless leg syndrome, a low sex drive, PMS, irregular cycles, depression, anxiety, emotional fragility, hypertension, cholesterol problems, excessive weight gain or weight loss, and the list goes on and on. Now my question for you is, do you have any frustrating health conditions? Well, if you do have concerning health symptoms, you've come to the perfect place to learn about what you can do about neutralizing them naturally. So, what really is FDN? As I've mentioned, FDN stands for Functional Diagnostic Nutrition. It is a program that works on everything related to the health of the body, but in a non-specific manner, removing interferences or blocks and restoring vitality, returning the body to good health. FDN is not a medical treatment. Now, medical doctors use drugs and surgeries. With FDN, there's no diagnosing and no treating specific diseases. Essentially, in our world today, we have two choices with our health. We have the medical disease care model or the natural self-care model. Now, medical doctors do save lives, but they are looking for something way out of range in a patient's health, or keeping an eye out for anything that is or might become serious. Many people are so very tired of the medical runaround of chasing symptoms. Symptoms really are not the problem. They are instead the result of the underlying real problem. So I ask you, are you tired of chasing relief for any of the health symptoms you have? Well, FDN fills this needs gap where doctors are not looking. FDN works to uncover the underlying causes of the symptoms by offering a step-by-step assessment procedure that allows you to identify underlying conditions, a method of correlating test results with your health complaints, validating them, and offering recommendations for therapeutic protocol, and potent, proven, drug-free protocols that help clients improve health instead of just treating symptoms. FDN practitioners seek the underlying causes, the real reasons of the health problem or disease, which is overlooked by the medical world because they are experts in treating symptoms which are results of the health problem or disease rather than digging deeper to uncover the real underlying root reason or cause of the ill health condition. Each of us has our own health game that we knowingly or unknowingly play while we're here on Earth. And we need to consider what it's really about so we can decide how we want to play it. For better understanding, let's look at the 5 stages of health disorders that lead to disease. Okay, let's take a look at the first stage of what the body goes through in a health disorder. Due to internal and external stressors, the human body contends with cells and systems losing equilibrium, or what we might call a healthy balance. Stressors outweigh the innate ability of the body to hold its health homeostatic balance, and therefore compensation begins to take place. Now, homeostasis means balance. And the body's systems get more out of balance. The second stage of disorder is called patho or disease physiology. And in this stage, the body is still compensating, trying to find a way to stay balanced, but it's not responding appropriately. There are slow catabolic or breaking down actions occurring within cells and tissues. Cells, organs, and systems enter a dysfunctional state of physiology, which sets the stage for a particular syndrome or disease. The third stage of the disorder or disease is called pathomorphology, and this means the disease changes. In this stage, the body is out of balance, homeostasis is lost, and the metabolism is dysfunctional. The body is still trying to compensate for the weaknesses. The continuous malfunction leads to morphology or change of the state of all the cells. So much breakdown occurs that a state of disease exists. In the fourth stage of disorder or disease, called symptomatology, the body is not able to return to its previous stage without serious changes in lifestyle. Normal function is lost. The body is challenged with symptoms from this breakdown. Pharmaceuticals that may be taken are only adding to the body's burden to function. The fifth stage of disease is death. The body cannot handle the change of physiology and cannot sustain the life force. The body's cells, organs, and systems cease to function. Now let's move into handling the body's chronic stress response to chronic stress-related disorders. FDN is a way of thinking about the human body that in time may become the new paradigm of standard medicine. Now I'd like to present the 7 FDN foundational principles. Number 1, the human body is designed to function perfectly in homeostatic balance of good health. Number 2, cells do not need to be taught what to do. Number 3, normal function is good healthy function. Number 4, cells, organs, and systems seek a state of ease. Number 5, symptoms are a signal that something is wrong. Number 6, FDN practitioners seek the underlying causes, the imbalances, deficiencies, or overburdened stressors and contributors to the dysfunctional metabolism or loss of healthy balance or homeostasis. Number 7, working at the deepest level possible, FDN practitioners restore balance, healing, and function the way it was intended to be, coaching up the body's vital reserve, its natural energies. FDN works because of sound principles. FDN practitioners do not diagnose or treat disease. Instead, they make observations. They seek healing opportunities and educate clients on how to behave in healthier ways. The process of removing as many stressors as possible unmasks the malfunctions that need repair, revealing weaknesses or vital voids that are inherent in a person's metabolism. And the client or patient invariably gets better as functions and/or inborn or acquired metabolic inefficiencies are repaired and restored. Okay, what I have to share next is pretty exciting. Many serious health complaints have been completely reversed using the FDN program. These include chronic fibromyalgia, chronic fatigue, irritable bowel, migraine headaches, achy joints and muscles, bad skin, overweight, low energy, foggy thinking, and the list goes on and on. Now, the healing process takes time. When all the factors that are causing the dysregulations within the body are removed and all genetically required components of health are provided. What we've come to know is that general principles of health building outperform specific treatments. Standard medical practices may fail to help with a health condition because so often it is looking at a specific part of the body that isn't functioning properly, rather than seeking the underlying primary cause of why the actual critical system is failing. For example, a person goes to seek medical attention for a skin inflammation, when in fact that skin problem is, really the result of a leaky gut, digestion, assimilation, and detoxification problems. The stress cascade. This is a fascinating concept, and it refers to hidden stress imbalances in one area of the body that, if not soon resolved, cascade into other areas of the body, contributing to what we might call metabolic chaos, which causes serious dysfunctions and leads to symptoms and disease. So here's another question. Are you tired of chasing symptoms? Do you really want to get to the real root cause of your dis-ease and discomfort? Next, I want to mention briefly intelligent allopathy. Although drugs can be dangerous, there are many times when using pharmaceuticals is advantageous. For example, when there is an acute condition that needs relief, like immediate relief from severe headache, hot flashes, hives, or heartburn. But we want to strive for an overall natural correctional care that focuses on helping the body rebuild, repair, restore, and thus solves the real health problem or health problems versus the medical relief care that many times just postpones the condition by relieving the symptoms, which can then reoccur later, having worsened. FDN is a highly individualized process because every human body is different. FDN practitioners use functional lab work to identify healing opportunities and guide therapy. The method will always improve the client or patient's health if he or she follows the suggested FDN protocols or the process of stress manifesting in serious illness and disease has not become so compressed. Now I'd like to share with you the value of test results. Test results from saliva and urine provide clinical data about how the body is functioning, especially with hormone, immune, digestion, detoxification, energy production, and nervous systems. Test results are interpreted with respect for each client or patient's genetic potential, history, environment, lifestyle, and current health complaints. These test results become relevant as FDN practitioners seek clinical correlation with each client or patient. Test results provide objective criteria to engage clients or patients in a process of education, self-care, commitment, and responsibility. FDN practitioners do not treat the test results or some specific symptom or problem. Instead, they treat the whole person. A specific lab system identifies malfunctions at subclinical levels within the body's hormone and immune systems, digestion and detoxification systems, energy production, and nervous systems. Then, FDN practitioners use the lab-guided health-building strategies and drug-free, all-natural protocols that work. Clients become engaged in a committed relationship of behavior and lifestyle modification, which supports the body's innate healing ability through FDN's special registered program called Dress for Health Success. Drugless protocol and behavior modification requirements are used that support the body's innate healing ability through special dietary suggestions based on that individual's metabolic type, recommended rest, certain approved types of exercise, evaluation of the individual's internal and external stressors with recommendations for stress reduction, very specialized specific supplements based on the results of the tests, and all these work to strengthen or improve the body's vital reserves. The FDN transformational process helps the individual adopt the self-care model based on behavior change. FDN practitioners help guide the individual on these healthy course corrections. As health detectives, here's what we do. Number 1, we follow a logical course of investigation. Number 2, we use very specific lab tests for observations, which may prove useful in identifying healing opportunities and pointing out weaknesses. Number 3, we seek hidden stressors and underlying malfunctions until the client or patient is well. Number 4, we use successive lab results to identify areas that need improvement and point to the next steps. Number 5, we use labs to tell us what to work on, how to work on it, where to look next, how to get deeper and closer to the real root cause of the health problem or health problems. And now a few words about metabolism. If we want to gain or maintain good health, we have to understand what metabolism is. Metabolism refers to the overall sum of the processes going on in a person's body in both the buildup, or anabolic, and the breaking down, or catabolic, of the chemical changes in living cells by which energy is provided for vital processes and activities as new material is assimilated. Homeostasis refers to the body's functional state of being in balance and healthy metabolically. It is where the body's vital reserve or metabolic reserve is at least meeting the challenges of or even dominating any contributors to dysfunctional metabolic processes that FDN practitioners call metabolic chaos. Fundamental homeostatic controls, or FHCs. There are 11 known and recognized FHCs that have controlling influences over our metabolism. Perhaps you know of some of these. We have the autonomic type, the oxidative type, endocrine type, electrolyte type, the acid-alkaline type, blood type, constitutional type, the prostaglandin type, catabolic-anabolic balance, steroidal hormone balance, and the neurotransmitter balance. In a body, stress of any kind contributes to loss of metabolic homeostasis, or healthy balance, creating health imbalances. Stress weakens the body and creates various dysfunctions in the body, which contributes to the body moving out of homeostasis and into disorder or dysfunction, what FDN refers to as metabolic chaos. In a weakened state of health, if left unchecked, the body's energy vital reserves diminishes and in time leads to dis-ease with symptoms. Here are some important considerations about stress. Stress-related illnesses and disease is the #1 causal factor in 70 to 80% of all doctor visits, and 50% of all illnesses are caused by stress. FDN practitioners focus on identifying stress coming from biochemical, chemical, and psychological sources in the patient or client to see how to reduce these physical, biomechanical, emotional, and mental stress influences. So, stress is any influence, internal or external, that causes or leads to malfunction with the body's metabolism. Examples are many, but here are some common ones. Physical stressors include such things as fractures, injuries, muscle weakness, nerve compression, repetitive or positional injury. Physical trauma accumulates over time and can manifest at any time, any place. Chemical, biochemical, functional stressors include things such as inflammatory foods and food additives, pesticides, prescription drugs, over-the-counter drugs, chemicals, alcohol, caffeine, radiation, parasites, sleep deprivation, toxicity, lack of sufficient hydration, and little to no exercise. Emotional, mental, and spiritual stressors include fear, worry, excitement, anxiety, lack of purpose, relationships, existential angst, covertness or lying, negative perceptions, and unhealthy attitudes. This one little word, stress, can be the main culprit, cause, or contributor to all these things. Low energy, chronic fatigue, general weakness, digestive insufficiency including heartburn, bloating, gas, leaky gut, reduced libido, ED or erectile dysfunction, frigidity, inability to conceive, headaches, migraines, brain fog, sleep disturbances, obesity, metabolic syndrome, pain and inflammation, anxiety, depression, mood disorders, attention, focus, and memory problems, heart disease, high blood pressure, high cholesterol, melanoma, leukemia, all kinds of cancers, hypoglycemia, insulin resistance, diabetes, and there's more. Arthritis, including rheumatoid arthritis and osteoarthritis, osteoporosis, balance or imbalance of body chemistry, maximize or minimize metabolic efficiency, reverse or cause degenerative disease, restore or undermine function, build or destroy health, optimize or inhibit immunity, improve or worsen digestion, heal or shut down the gut, promote or impede elimination, increase or decrease detoxification, maximize or minimize hormone production. And we can see how important it is to reduce and or resolve as many stressors in our lives. So how do the FDN practitioners do it? Well, they gather a patient or client's very detailed current health and medical history. They do a very specific lab testings of saliva and urine. They review these test results and correlate this information with the symptoms that the individual is experiencing while considering their health condition, their genetic potential, the type of stressors they have, and the duration of the stressors. And then they develop a very individualized protocol or health building program based on the Dress for Health Success program, which is a registered name of FDN. I'd like to share with you just how stress affects our human body, and then I'll explain the labs. Since stress plays such a major part in a person's health conditions, and the reduction of these stressors play a major part in a person's recovery and healing, here's some basic information about how the body actually handles stress. The first responders to any stress include the sympathetic nervous system, the hypothalamus, the pituitary, and the adrenals. Fight or flight. You've heard this saying, right? Let's imagine our body's response to this. We're taking a quiet walk, and all of a sudden, a big dog we don't know starts racing towards us, barking loudly. Our body immediately goes into fight or flight mode. Our adrenaline kicks in fast. What should we do to protect our safety? This is an example of what happens to us in stressful situations. Now think about this in relationship to your own life. What are your main stressors that produce that ongoing, uncomfortable level of stress that the body reacts to? Stress comes in so many forms. It can come in the form of an important relationship, or work you do, or lack of money to pay your bills, or health problems you have, or lack of direction you feel to be living a purposeful life, or lack of being financially rewarded for your efforts, or not having the kind of life you'd really like. Or maybe it's some, or maybe it's all of these. These situations create stress in the human body. The sympathetic nervous system, which is a part of the autonomic nervous system, triggers the adrenal medulla to produce adrenaline. It also tells the hypothalamus to put out a hormone called CRH, and this triggers the pituitary to release a hormone called ACTH, which triggers the adrenal cortex to produce cortisol. So can you see how the adrenal glands are really being challenged in the stressful lives many of us have to produce adrenaline and cortisol? Cortisol is the body's stress hormone, produced in a part of the adrenal gland. So when we're young, we usually have a much stronger vital reserve or natural energy within us. Our nervous system, hormone levels, glands, organs, and systems tend to be resilient. We tend to bounce back fast from the different stressors of life. Over time, however, I think you can see how the stressors of life can really start taking their toll on body systems and glands, and especially the adrenal glands. Our recovery rate from stressors gets slower and tires us out a little more easily. The adrenals in particular really suffer since they must react to stress by somehow creating and pumping out adrenaline and cortisol. So what if the adrenals get weak and have trouble producing cortisol? Let's look at the main roles cortisol plays in the body. Cortisol is a steroid hormone produced in the adrenal cortex. It is a natural anti-inflammatory and painkiller. It suppresses gastric juices, and its main job is to raise blood sugar. Aha! Cortisol's main job in the operation of the human body is to raise blood sugar. So let's remember that cortisol is the stress hormone. What happens if stress has weakened the adrenals so they have trouble producing enough cortisol to keep the blood sugar at healthy levels? It starts looking for where it can get it elsewhere. So where does it start stealing from when the adrenals get weak? The pregnenolones steal. It steals from the granddaddy of the steroidal sex hormones called pregnenolone. Ever heard of pregnenolone? I hadn't until I started studying FDN. Actually, pregnenolone is the parent of DHEA, which is a very important anti-aging hormone that is also the balancer of cortisol. And it is the grandparent of testosterone, progesterone, and the estrogens, the sex hormones. We can see how if the adrenals can't produce enough cortisol on their own, and they start stealing from the steroidal sex hormones to keep up their blood sugar role in the body, all kinds of imbalances can occur in the hormones, which affects all kinds of other reactions in the body. This is how stress on one organ or gland contributes to affecting other systems that starts creating what we call the stress cascade, which then starts creating the metabolic chaos in the body. Wouldn't it be great to have a test that produces results about how your adrenals are functioning in the production of cortisol? Well, that's one of the 5 main tests we do in FDN called the Adrenal Stress and Hormone Saliva Panel Test. This test measures cortisol at 4 times during a 24-hour period, morning, noon, afternoon, and nighttime. Most doctors just run an overall daily cortisol sum, but this does not capture what's really going on during the circadian rhythms within the 24-hour period, which is very important in assessing blood sugar. Through this one specific adrenal stress test, FDN practitioners can, number 1, get clues about malfunctions, hidden stressors that might be contributing to metabolic imbalances. Number 2, evaluate the 24-hour circadian rhythm cycle within the body through cortisol and melatonin patterns to see what time of day are the weaknesses occurring. Number 3, assess catabolic and anabolic balance, or the breaking down and building up, by giving a DHEA cortisol assessment total. And number 4, assess steroid hormone pathways to see where the estrogens, progesterone, and testosterone are in or out of balance. Number 5, evaluate steroidal hormonal balance. Estrogen, progesterone, and testosterone levels have to be in balance to be healthy. When a body is weakening, one of the first areas to head south is the steroidal hormones of cortisol, DHEA, estrogens, progesterone, and testosterone. Number 6, the melatonin levels, which is a surprising window into the gut health or dysfunction, since 80% of melatonin is produced in the gut. Number 7, get 11 important baseline measurements on 7 hormones to begin the health improvement process by suggested therapy to develop a protocol or program to follow for relief, correction, and maintenance. Here are some thoughts on how many doctors and practitioners work. Mainly, they just treat test results. For example, they may look at a level of a person's estrogens or testosterone and say, "Oh, it's low, so here you'd better take this medication to boost it up." Or, "Oh, your cortisol level is high, you'd better get on some type of blood sugar balancing medication." Instead, FDN practitioners look at how the test results correlate with how that person is feeling to get clinical correlations to that person's symptoms, and then offer natural remedies based on lifestyle changes and natural supplements to coach up that person's vital reserve. So FDN practitioners coach up the client's vital or metabolic reserve and coach down contributors to the client's metabolic chaos, which leads to the return of good health and vitality, and symptoms disappear. Here's another important consideration for you to know about. Many lab statistics have nothing to do with health building. They are only gatherings of numbers of people's tests that reflect the population's test results. So if the population is getting more and more unhealthy, then the median or average or normal range is moved down to an even unhealthier range. But FDN has its own unique and very accurate optimal health ranges for the 5 suggested main tests. These are based on FDN founder Reed Davis's research and test result analysis and evaluations over many years, working with many thousands of clients throughout the world on these specific tests to better their health. So when you work with an FDN practitioner, you have access to this vital health-building knowledge of what truly are optimal health ranges for the test results. FDN as a lifestyle and health-building program is now in 40 countries and growing. Here are the 5 main tests used in FDN. Number 1, the adrenal stress or sex hormone profiles. Number 2, the metabolic assessment profile. Number 3, the intestinal barrier function or permeability test. Number 4, the GI or gastrointestinal pathogen screening. And number 5, the food sensitivity test. The second important test is called the Metabolic Assessment Profile Test. This test is a urine test taken in the morning after eating substantial flesh protein the day before. It identifies conditions within the body relating to 3 important areas of health: digestion, measuring indican; oxidative stress, measures lipid peroxides; detoxification, measured by urinary bile acids. Here's what that test can tell us about the digestive system. What is the condition of digestion and absorption? Is it good or poor? Is there intestinal toxemia or overgrowth of anaerobic bacteria? Is there small intestinal bacteria overgrowth, dysbiosis, leaky gut, or pancreatic insufficiency? There are at least 10,000 different proteins that make you what you are. The urinary indican is measured through valuations of a protein found in flesh proteins. Symptoms include poor glycemic control, hormone imbalances, hydration issues, halitosis, gas, bloat, dysbiosis, and liver congestion. From this test, we can also learn about the oxidative systems in the body. Is there excessive oxidative stress with free radical damage? This can cause cancer. Is there accelerating aging and breakdown? In a healthy body, antioxidant compounds counterbalance the oxidative process, but this activity can be thrown out of balance from exposure to toxins or pathogens or even overexercise and inappropriate lifestyle stressors. Lipid peroxidation buildup is a major cause of tissue and cellular dysfunction, aging quickly, and stress-linked diseases including renal and liver diseases, cancer, diabetes, and atherosclerosis. It decreases the lifespan. Symptoms include fatigue, memory loss, brain fog, muscle and/or joint pain, wrinkles, impaired eyesight, susceptibility to infections. From this test, we can also learn about the body's detoxification processes. Is the liver congested? Are there detoxification problems? Are there fat metabolism problems? How is the enterohepatic circulation? Is there excessive antigen or immune complex load? Is there presence of infection or parasitic infestation or serious liver disease? The liver may be the most important organ for supporting physical health. It processes 3 pints of blood per minute. It cleanses the bloodstream by removing toxins of waste products from normal metabolism, is vital to the immune system and energy production, is a source of bile, stores glycogen, which can be converted to glucose. The urinary bile acids in this test are an indicator of liver and gallbladder function and the enterohepatic circulation of bile. Excessive bile acids leach into general circulation. A missing or congested gallbladder or poor intestinal and enterohepatic circulation of bile may result in lower than normal bile acid recovery. It is easy to detect in urine as bile acids filter through the kidneys. Symptoms of congestion or imbalances in the liver include hard to lose weight, sluggish metabolism, unstable blood sugar levels, elevated LDL cholesterol, elevated triglycerides, reduced HDL, indigestion, intolerance to alcohol, caffeine, and fats, reoccurring headaches, hormonal imbalances, putrid body odor, and IBD or irritable bowel disease, and diarrhea. So to recap, do you have any of these symptoms or health concerns? Allergies, asthma, acne, rosacea, unstable blood sugar levels, poor glycemic control, diabetes, sleep problems, insomnia, wakefulness, headaches, fogginess, indigestion, gas, bloating, fatigue, lethargy, malaise, inflammation, pain, restless leg syndrome, low sex drive, irregular cycles, PMS, depression, anxiety, emotional fragility, hypertension, cholesterol problems, excessive weight gain or weight loss, hard to lose weight, sluggish metabolism, and there's more on the next slide, liver congestion, elevated LDL cholesterol, elevated triglycerides, reduced HDL, intolerance to alcohol, caffeine, and fats, hormonal imbalances, dysbiosis, halitosis, putrid body odor, IBD or irritable bowel disease, diarrhea or constipation, fatigue, memory loss, brain fog, muscle and or joint pain, wrinkles, impaired eyesight, susceptibility to infections, hydration issues, and there's probably more. With just these 2 tests, the one saliva-based adrenal stress sex hormone test and the one urine-based metabolic assessment profile test, FDN practitioners begin investigations into what's malfunctioning and then recommend a plan of action, a protocol or program designed just for your unique body's genetics, biochemistries, and metabolism. There are 3 questions we receive most frequently. They are, do you know what's wrong with me? Can you help me? Have you helped others like me? To answer the first question, do you know what's wrong with me? Yes, there are dysfunctions going on in your body, interferences in a healthy functioning of your metabolism. To answer the second question, can you help me? Yes. FDN practitioners become health detectives and help you identify the healing opportunities. If you identify with the FDN's program and you can follow the FDN suggestions, you will find help. To answer the third question, have others been helped like me? Yes. It's some kind of malfunction or dysfunction, and if you're willing to follow the recommended protocol, FDN practitioners have helped thousands and thousands of people feel better and get well. This concludes part 1 of my introductory presentation to FDN, which presented the importance of obtaining 2 specific tests of both saliva and urine to reveal important healing opportunities for that person. Now, please listen in on my Part 2 introductory presentation where I present the importance of several other tests that include stool tests that can be even more essential in getting to the foundational or real causes to the metabolic imbalances going on in the body that are the result of not feeling well or being sick or having a disease. For most people, starting with the saliva and urine tests are easiest and more workable in our everyday life, but in time, all 5 are highly recommended if your plan and your goal is to create optimum health. Remember, functional diagnostic nutrition practitioners are health detectives. So if you would like to discuss your particular health concerns, please contact me through the information on this screen. Thank you for spending time to learn about this amazing FDN health building program and how it can help better and better your health. This is Barbara signing off. Bye-bye for now.